thoughts that are associated with the panic attack. Now, this, as we mentioned, this might happen out of the blue. Someone can be walking on the street and all of a sudden they get these feelings.
Even if they don't, if they are not experiencing something new,
nothing.
They're doing
it
the
comes
routine
out of the blue.
while they're going to their work.
While going to their work, while they are entering a supermarket, all of a sudden there is they experience this, really sensation which is unpleasant, as if something is scaring them, as if they are, as if they are subjected to something fearful, but there isn't. What is happening is that the brain cells are firing off and producing symptoms similar to what happens in a normal fear situation. So it's actually the body is tricking the patient, because it's telling the patient to be afraid, but there is nothing to be afraid of.
Too afraid of.
But the patient gets afraid because they feel the heart pounding. They think, oh my God, what's going to happen to my heart? I'm going to have a heart attack. I'm going to faint now, because it's scary.
And how you can help these patients after you diagnose that they have panic attacks?
Okay. Just to mention, I will go to the management, but it can, as I said, can happen out of the blue, or it can happen after watching, for example, a car accident.
Okay.
And it then becomes recurrent at that time. So after we diagnose this condition, then we come to the point of management. Now, what I use mostly is I use medications to treat this condition, panic disorder. And these medications are quite safe and can really reduce the symptoms to a great deal. I tell my patients that it doesn't take away the panic symptoms 100%, but it can reduce them from up to maybe 80 or 85%. Do you want to talk about medications now, or we'll leave it later?
I would like to go back to anxiety.
Yeah.
Now, you mentioned anxiety, that you are afraid of something, but when it's more than usual, this is considered anxiety disorder. So there is a factor that we are afraid from, and we're trying to avoid, but it's we start to develop symptoms and difficulty to deal with. Like, let's say anxiety from due to work. Can that happen? People who develop anxiety during exams?
No, work-related anxiety is not common. It's not considered. And exam anxiety, as I said, is normal anxiety.
Okay.
This is normal. This is not pathological.
What about if this leads to somebody who really becomes very aggressive, becomes really irritated? Can we consider this anxiety disorder? Doesn't affect their their study.
Doesn't really anxiety disorder doesn't really lead to any aggressive behavior.
Okay.
They become more tense, fearful, apprehensive, worried, and sometimes even depressed. If it continues for a long time, they even become depressed, and they start having symptoms. I mean, they already have symptoms of anxiety. They start developing symptoms of depression, which is, low mood, lack of interest, and then it becomes a little bit more complicated. That's why, I encourage people that if they have anxiety symptoms, that they don't wait saying that, oh, maybe it's something. Go for a consult, and, if it is just something, if it's just one attack, then that's fine, nothing. But if it is recurrent, then I think they should be on treatment.
Is the treatment different between the two, the panic or anxiety disorders?
No. Basically, we use a group of medications, if you want to talk about medications, which is called the SSRIs.
Stands for?
Selective serotonin reuptake inhibitors. Leave the jargon aside.
Yeah.
They are basically antidepressants and anti-anxiety medications.
At the same time?
Yes. This is a new group of medications that developed over the last 10 years. We used to have the old group of medications that we have for 30 years or so, but the older group of medications have, unpleasant side effects of dry mouth, blurred vision, weight gain. They are unpleasant, and you have to take them 3 times a day. They are unpleasant. The new group of medications, most of them taken once daily, okay. They don't have this dry mouth and this other unpleasant side effects. All medications have side effects, but these medications are more tolerable, so
Than other
they have less side effects. They are taken once daily, and they are, safe on the heart, on the kidney, on the liver. They don't affect your other organs. Now, just few words. They take 2 weeks to produce their effect.
Okay.
So they don't show effect before that time. So I tell my patients to be patient and wait for the first 2 weeks until they produce their effect. Unfortunately, within the first week, they start experiencing the side effect before the positive effect.
So you have to mention that to the
So
patient.
I tell them that,
Okay.
the first week is the week when they start experiencing maybe this possible side effect. Some people don't feel anything.
But,
The lucky ones don't experience side effect.
but these are anticipated things that to happen. It's not unusual.
No.
But
So
we
I
have
tell
to
them,
mention it.
mostly they might experience some kind of nausea or headache or maybe some sort of sedation.
Yeah.
So these are the possible side effects that I warn my patients about.
Dr. Abdullah, we have a call. Tony?
Yes. Good evening.
Good evening, Tony.
Yeah. I must thank you for this program that you have regularly on Sunday.
Thank you.
I'm an
I
ardent
thank you,
watcher
Tom.
of this program,
Okay.
and I especially make time for this.
Okay.
Okay. So I have 3 suggestions actually, or you can say some semi-questions.
Okay.
The first one is that most of us don't know how to identify these disorders,
Mm-hmm.
Okay.
and but we need to have sort of therapies, just not to have them or whatever. And I used to watch a health program back in my own country,
Okay.
India,
Oh.
and they used to say laughter is the best thing to do.
What is?
Laughter.
Laughter.
Yeah. That
Sorry.
was one. And the
Okay.
second question I have is,
Yes.
normally worrying is one of the disorders. I am not too sure whether the doctor would agree with me.
Worrying.
But worrying, W-O-R-R-I-Y-I-N-G,
Yes.
yeah. And is that connected with this graying of hair?
Uh-huh.
Okay, and my third question is, don't we lack this positive thinking should we not have positive thinking to get rid of any of these disorders that we have?
Okay.
Okay, doctor.
All
Thank
right.
you.
Okay. Regarding the first question, Tony, just be a second with us.
What is the first question?
What
I
was
missed-
the first? I couldn't get the question.
My first question
Yeah.
was, we have a lot of disorders.
Uh-huh.
Yes.
We don't recognize them.
Mhm.
Okay.
But ordinary people require sort of a therapy,
Therapy.
Okay.
huh?
like say laughter.
Okay.
Laughter would be sort of a therapy that would
Okay.
overcome these disorders.
All right.
Okay. Thank you, Tony, for calling.
Yeah, thank you.
Okay. Well, anything, any condition. I mean, if someone is working and functioning properly without any problems, they don't need to see anyone.
Okay.
But whenever, for example, there is something like the panic symptoms are, they affect the people negatively. People become worried, people become preoccupied, people are not as efficient as they are, so it affects them. So when it comes to that state, I think, they should consult a psychiatrist. And I say consult because it's a consult. It's not going to harm them.
Okay.
Just to make sure what is going on. They are either reassured or they are advised in that they need regular follow-up.
You mentioned something about positive thinking. Can positive thinking help
Yes.
to get rid of panic attacks?
Yes,
Or,
yes.
anxiety
Now there is, besides the medication, there is a kind of therapy that's called cognitive behavioral therapy, and which basically deals with the cognitions. The cognitions are our own perceptions, our own understanding of what is going on. And the therapist try to, deal with these faulty cognitions or faulty assumptions. For example, when someone is walking and then they start having palpitations, the immediate thought that comes to them, I'm going to have a heart attack,
Okay.
or I'm going to faint, or I'm going to die. So they link between the palpitations and that they are going to have a heart attack.
Okay.
This is faulty assumption and this is faulty connection.
Okay.
Cognitive therapy tries to show to the patient that, what is happening is that simply we have what we call alarm system.
Mhm.
All of us, human beings and, other creatures, living creatures, we have an alarm system. The function of this alarm system is to alert us about threat. When there's a threat in your immediate environment, you are alarmed so you can respond.
Okay.
So you can either fight or flight,
Okay.
or fight or fly. What happens in patients with panic disorder is that this alarm system fires off automatically, without the specific
stimulus
threat,
or
stimulus or threat.
Okay.
So we try to tell patients with this cognitive therapy that basically your body is acting out and it is false alarm. And it basically your heart is, beating fast, but it will stop. I mean, it will go away. It doesn't mean it will stop, they will die. It will slow down. Okay? You are feeling shortness of breath. This unpleasant sensation is temporary. It will go away. It is part of your panic attack. So breaking this link that between the symptom and the thought is what we do in cognitive therapy. And this is, it is a complicated, again, process. It takes 8 to 10 sessions.
Before they develop this awareness about the faulty,
yes, because we go through probabilities and possibilities and, faulty assumptions and all of that. And so some of it, if you can want to call it this positive thinking, then this is the, proper therapy. It doesn't mean that, you say to yourself, no, I am fine, there is nothing wrong, this kind of talk. This is not what's meant by therapy.
Now, he mentioned something about worrying. Can worrying cause gray hair?
I'm not entirely sure about that. So I know gray hair is genetic. So if your father has gray hair, you are most likely to have gray hair. But does worrying cause gray hair? Possible, but I'm not 100% sure.
Okay. Now, let's go back to about the treatment. You mentioned about these treatments, that the new type of treatments that can help anxiety and panic disorders, and you were going to explain about other medications that can be used other than
yes. So while this medication is while we are waiting for this medication to take its effect, we also use an adjunctive treatment, which is just a temporary treatment while this medication is producing its effect.
Okay.
And this group of medications are called anxiolytics, which means that they target anxiety. And these medications are, they act immediately, which means within an hour, the patient start feeling calm and less anxious, and more relaxed. And they can also feel a bit drowsy or sedated.
Is that why they are using only for temporary period?
Temporary
it's not
period.
Good for long period.
Yes, we try to avoid using them, and some people, unfortunately, depend on these medications, but because they don't use them properly. If they use them properly, there is no harm in them at all. If they are used as per the directions of the treating doctor, they are very safe medications and they don't cause any harm. And then they can be used only as needed in the future, after the first 2 to 3 weeks.
Okay.
So the best way to use these medications is for a short term or as needed, not to use them regularly, because then the problem becomes that they might become dependent on these medications.
Now, let's say that after 2 weeks you start to control the panic and attacks. How much you can control them? Can you control them completely, that there is no panic attacks at all the whole
As I
month?
mentioned, I'm realistic with my patient. I tell them that if we control 80%, 85%, this is really success.
Okay.
Because, and this is, my patient come back and tell me, yes, you are right, doctor, because now they come in a very mild form and it doesn't bother us.
Oh, so
I tell them that they do feel this kind of, minor or a mild form of the symptoms. They do feel slight maybe palpitations from time to time. They last shorter, the episodes last shorter, and they are not as intense as before they start treatment. And it doesn't bother them, and they function normally, and they are, quite happy with the result.
If start to bother them a little bit, can they use the anxiolytic, or they have to increase the dose of